Pain. How would you feel if you had constant, excruciating pain? More people than ever are getting diagnosed with chronic pain, and the main solution is painkillers. The most common kind of painkillers are opioids. Unfortunately, people grow dependence on opioids, which leads to people getting addicted to them. Opioid addiction is a problem that has been apparent in Utah over the last few decades. Due to pharmaceutical companies and pharmacists wanting to make a profit, they ignored the issue of people dying of opioid overdose. These companies and pharmacists were left unchecked, which let the program grow to a point it was deemed an epidemic. Even though numbers went down when it gained the whole country's attention, Utah has had a resurgence in the last few years. Newer systems have been put into place to help lower the opioid abuse, but it is still not regulated and it can be left unchecked. Putting measures into place to check these steps in prescribing opioids can help eliminate opioid addiction.
Patrick Radden Keefe goes into great detail on the rise of opioids in his book, Empire of Pain. Opioids first came out in the 1990s, pioneered by Purdue Pharma to help treat chronic pain. Purdue Pharma pushed a massive marketing campaign to promote it to doctors, pharmacists, and the public to get those with all types of pain prescribed to it. Purdue's marketing worked almost too well, leading to millions of people worldwide getting prescribed it. What helped with their marketing was their false claim that their opioid, oxycodone, was non-addictive, making those getting addicted and dying from opioid overdoses a problem not for them, but the public. Other kinds of opioids, such as hydrocodone, helped lead the country into an epidemic because of deceitful marketing, making the problem less apparent until later on. Although the graph appears stable between the years of 2020 through 2023, Utah's overdose numbers have gone up. Utah was one of only 5 states that saw a jump in overdose deaths. Lawsuits and other actions have taken place to try to reduce the problem. In an interview with pharmacist Josh Fitzgerald, he mentioned that pharmacies in Utah have taken action by adopting electronic prescription systems that help reduce forgeries and as a more direct way of getting prescriptions. However, not all pharmacies use these, showing that there are still workarounds to people getting opioids. A bad rap doesn't eliminate the problem, it just lets it simmer down but still burns. Implementing a permanent solution will help these falls and rises of opioid addiction in Utah.
Utah has endured a wildly complicated and long history of abuse of prescription opioids, starting in the late 1990s. It was at this time that several drug companies inundated the state with an unprecedented amount of highly potent and addictive painkillers that precipitated a sudden and shocking rise in rates of addiction and overdose cases among its citizens. Even as the quantity of prescriptions written was increasing steadily year after year, at the same time, there was an unprecedented surge in the number of opioid-induced deaths across the state of Utah. As a reaction to the growing problem of opioid misuse, the state of Utah has acted by proposing a sequence of proactive measures meant to combat the problem, including measures focusing on enhancing access to centers of addiction treatment, which is crucial towards offering care to individuals suffering from substance abuse disorders. Utah has also started new prescription drug monitoring programs to track and control the distribution of such drugs. To this is added a greater focus on the different risks and dangers of using opioids, which is a huge component of public education. Even though these efforts have gone a great distance towards offsetting the effects of the crisis, it has to be understood that still a great deal needs to be done to totally resolve this complicated issue. As we move further into the future, it is important that Utah keeps working towards effectively battling the misuse of opioids. They're taking positive actions to promote and raise awareness of the severe dangers of opioid misuse. They're enhancing access to a broad range of effective treatment and applying prevention practices with an evidence base. Utah will be able to make noticeable changes in the right direction. It is a problem that promises to consume not only the health and well-being of these individuals, but the very social and communal fabric that constitutes society itself. It is this final and most urgent goal that will be realized through the combined, concerted, and unified efforts of various sectors that will unite hand in hand. This does not merely include government institutions, but medical professionals, community groups, and individuals themselves. All these different groups will need to come together and coexist harmoniously in a way that will leave an irreversible and lasting mark on the lives of victims of the current scenario.
Opioids weren't the only prescription drug being abused, but are the most common. As the availability of both over-the-counter and prescription medications has grown, medications that were previously classified as harmless are now being misused. Early on in the opioid epidemic, fentanyl wasn't a widely distributed drug both pharmaceutically, like the graph shows, but illegally. In recent years, fentanyl deaths have been on a rapid rise. Fentanyl is a synthetic, more potent opioid than prescription opioids. People have found ways to make opioids more effective by adding psychostimulants like cocaine. According to a study by Eric Lundstrom, those who have used psychostimulants with opioids are also using them with synthetic opioids like fentanyl. This shows that people have been using both prescription and synthetic opioids. But with the rise of fentanyl deaths in the last few years, people are transitioning from their prescription opioids to fentanyl. This is also confirmed by local pharmacist Josh Fitzgerald, who said while prescription opioid abuse isn't as rampant as it once was, those transitioning to fentanyl is on the rise. Fentanyl overdoses are a big problem in Utah, with almost half of all overdose deaths including fentanyl. Reducing those getting addicted to prescription opioids can help prevent people from transitioning and overdosing on fentanyl.
Utah legislation has seen these problems and have tried to put into place policies or laws that can help people struggling with these addictions. Andy Pierucci, a member of the Riverton City Council, commented that he was in favor of legislation that would ensure prescription drug copay assistance is counted towards patients' out-of-pocket cost obligations. This shows that it is difficult to get bills to pass when it has to do with prescription drugs, making it much more unlikely that one helping specifically with opioids will pass. However, some of these bills do make it into law. One such policy that has been put into place is the law HB 199, which would allow first responders to connect overdose survivors to treatment resources while prohibiting syringe exchange programs in certain areas. Pierucci also notes that overdoses are the #1 cause of death for homeless people in Utah. This law would help to reduce those deaths, as it would let medical professionals get these people into treatment facilities, letting them help those people who are addicted to drugs and opioids. The second part of this law prohibits syringe exchange programs for certain areas. This may help to reduce the amount of people who are or get addicted to drugs or other substances. However, this and similar laws don't specifically target opioid addiction. There needs to be much more direct laws put into place that regulate prescription drugs. But because of the difficulty with passing legislation regarding the regulation of prescription drugs, it is unlikely for this to happen.
Pharmaceutical companies play a greatly immense and influencing part in the persuasive and problematic opioid crisis being experienced across the state of Utah. From the initial stages of the production phase, where the drugs are formed and manufactured, right through until the end points of distribution, including obtaining the products into the hands of practitioners and patients. All choices made by these corporations can have profoundly affecting influence on the lives of millions of individuals within the population. Healthcare workers are the front-line warriors of the daily struggle against the opioid epidemic. They see firsthand the horrible effects of opioid addiction and abuse, seeing it clear with all perspectives of the epidemic that kills so many. And last but not least, right at the center of the opioid epidemic of today and multi-level with far-reaching consequences are the very ones most profoundly and closely associated with the issue, the very users themselves of opioids, who are directly affected by the state of affairs reigning supreme in the midst of this full-blown epidemic. By learning about and relating to their own lived experiences and life realities that shape them, we can gain an incredibly profound sense of awareness and appreciation for the numerous numbers and issues that they encounter on a daily basis.
All right, now that we have covered the historical context, stakeholders, and current policies around opiates in Utah, I'd like to walk you through our proposed solution, one that is both actionable and sustainable. This solution focuses on modernizing oversight systems and leveraging technology to prevent opiate overprescription before it starts. Let's start with clinical practice proposals. Our solution concludes with the implementation of a regulatory oversight software system. This tool would operate in real time, flagging unusual prescribing patterns and identifying outlier physicians or pharmacies with abnormally high volume of opioid prescriptions. While a version of this program already exists, it remains significantly underutilized, meaning we're missing key opportunities to catch red flags early. That's why further implementation and proper enforcement are urgently needed. Now, building on that foundation, let's talk about how this system could be improved. A more advanced system would integrate data from state prescription drug monitoring programs, which are also known as PDMPs, and insurance claims. This allows us to analyze prescribing trends more holistically. Even more importantly, we'd use AI to detect patterns that suggest the presence of pill mills, which are pain management clinics prescribing medication without proper medical indication. These often result in overprescription or what's known as doctor shopping, where individuals seek multiple prescriptions from different providers. But to make this all work consistently and fairly, we need more than just software. We need strong oversight. That's why we're proposing the creation of an independent oversight agency, similar to the Consumer Financial Protection Bureau, but for health data. This agency would not be influenced by pharmaceutical lobbyists and would focus only on patient health outcomes and cost transparency. Its role would be to oversee and regulate this entire system, ensuring that it actually serves public health, not private profit. To understand why this is such a critical need, we need to turn to Dr. Marty McCarty's work in The Price We Pay. Dr. McCarty argues that one of the biggest contributors to the opiate epidemic is the lack of standardized prescription guidelines. Many hospitals and doctors don't even realize how much they're overprescribing. One of his key proposals is to build clear guidelines into clinical tools so that physicians are supported in making safer decisions. This is where AI comes in. These guidelines would feed directly into the software, helping to prevent overprescription from snowballing into addiction. However, even with these tools available, they're not always used. As you could see, this excerpt by the Department of Health and Human Services states that as of July 2013, 47 states had operational PDMPs. However, they are significantly underutilized by providers. Part of the reason is that these systems are cumbersome and raise privacy concerns, which makes healthcare workers less likely to engage with them. So how do we fix that? First, we need to improve and modernize these systems so that they are part of a natural clinical workflow. Tools like clinical decision support systems, also known as CDSS, can be integrated into electronic health records to provide real-time alerts, which help doctors make better choices. Similarly, FDA risk evaluation and mitigation strategies, or REMS, are already in place for some opiates, but their full potential has not been tapped. To make sure that these tools are actually used, here are our top implementation priorities. First, we must standardize PDMP data across state lines. Right now, inconsistent data limits how effective these systems can be. Utah should lead the charge in unifying and updating how patient prescription data is shared. Second, we should apply predictive analytics and AI to identify doctor shopping, overdose risk, and high-risk behaviors before they escalate. These insights should be delivered directly to providers at the point of care. Third, we need to improve the user interface and experience of these platforms so that they are intuitive and don't disrupt patient care. And fourth, the accuracy and reliability of the data must be improved through regular updates, standardized entry, and built-in error checks. And finally, none of this will matter without someone to ensure it's done right. That brings us back to the idea of an independent oversight agency, one designed to protect health data integrity and hold prescribers and companies accountable. This agency would regulate the systems we've outlined, shield them from pharmaceutical influence, and make sure Utah's approach to opioid prevention is focused on saving lives and not serving profit. If we can implement these solutions together, oversight, AI, education, and accountability, we can start to make a change regarding the opioid crisis in Utah.